Hi everyone, my name is Varun Babu. I am going to present about granulation tissue and hemangioma. Granulation tissue. What is granulation tissue? Granulation tissue is a specialized type of healing tissue formed in wounds, characterized by proliferation of new capillaries, fibroblasts, and inflammatory cells, which ultimately matures into scar tissue. Functions: it fills the wound defect, replaces the tissue lost due to injury. It also provides a framework for healing. It acts as a scaffold for the growth of new tissue. Promotes angiogenesis. Newly formed capillaries due to angiogenesis supply oxygen and nutrients to the healing areas. It produces collagen and extracellular matrix. The fibroblasts synthesize collagen and providing strength to the wound. Supports epithelial regeneration. It facilitates migration of epithelial cells over the wound surface. It leads to scar formation. It gradually matures into fibrous scar tissue during wound remodeling. This leads to the formation of scar. Gross appearance of granulation tissue. The granulation tissue appears soft and it has a granular surface. Hence the name granulation tissue. It appears pink to bright red in color due to numerous newly formed capillaries. The capillaries give it the appearance of pink to bright red color. It is moist and edematous. It is friable. Friable means it gets easily damaged. It bleeds rapidly on touch because of its rich vascularity. Seen as small, velvety granular on the surface of healing wound. This is the picture of granulation tissue. We can see that it is pink, soft, granular, and it is seen on the surface of a healing wound. Now let's look into the microscopy of granulation tissue. We should remember mainly 3 points in the microscopy of granulation tissue. The first point is proliferating capillaries are seen under the microscope. This process of formation of new capillaries is called as angiogenesis. Numerous newly formed thin-walled capillaries appear under the microscope. The newly formed capillaries are lined by plump endothelial cells. They are often arranged perpendicular to the wound surface. Fibroblasts are also seen under the microscope, actively proliferating spindle-shaped fibroblasts. Synthesize collagen and extracellular matrix. The fibroblasts are responsible for synthesis of collagen and extracellular matrix. Inflammatory cells are also seen under the microscope. The mainly seen inflammatory cells are macrophages. Also lymphocytes, plasma cells, and occasionally neutrophils are also seen under the microscope. Additional microscopic features of granulation tissue. It is loose, edematous extracellular matrix is seen. Early lesions contain abundant capillaries and fewer collagen fibers as compared to the older lesions. As healing progresses, collagen deposition increases and vascularity decreases, leading to scar formation. This is the microscopy of the granulation tissue. We can see plasma cells, macrophages, lymphocytes, fibroblasts, neutrophils, and we can also see angiogenesis. Clinical importance of granulation tissue. It is the indicator of wound healing. Granulation tissue indicates the healing process of wound. Presence of healthy granulation tissue signifies active and normal wound repair. It fills tissue defects. It occupies spaces created by the injury and acts as a framework for tissue regeneration. The granulation tissue is the precursor of scar formation. The granulation tissue gradually matures into fibrous scar tissue through collagen deposition and remodeling. The granulation tissue provides blood supply to the wound. Through its newly formed capillaries, it delivers oxygen and nutrients which are essential for healing of the wound. Excessive granulation tissue. Proud flesh. Overgrowth of granulation tissue above the wound surface can prevent epithelialization and it can delay the process of healing. Granulation tissue helps to assess the status of the wound. Healthy granulation tissue is pink, red, and moist. Pale granulation tissue suggests poor vascularity. Hence, it takes a longer time for healing of wound. Unhealthy or infected granulation tissue may appear dark, edematous, or bleed excessively. Now, to summarize about what we have seen about granulation tissue, in simple words, granulation tissue is a healing tissue which forms wound during its repair process. The key features of granulation tissue are: it is pink to red in color, soft and granular in appearance, rich in new blood vessels, contains fibroblasts that produce collagen, helps to fill the wound and eventually forms scar. Now let's look into hemangioma. What is hemangioma? Definition of hemangioma. A hemangioma is a benign vascular tumor characterized by proliferation of blood vessel endothelial cells resulting in localized mass of blood vessels. This is called as hemangioma. Types of hemangioma. Hemangioma is of two types: capillary hemangioma and cavernous hemangioma. Capillary hemangioma. Capillary hemangioma is a benign, non-cancerous vascular tumor composed of proliferating small blood vessels. It is one of the most common tumors of infancy and childhood. It is seen most commonly in children. Types of capillary hemangioma. There are two types of capillary hemangioma. Strawberry hemangioma. Strawberry hemangioma is also called as juvenile hemangioma. The strawberry hemangioma appears bright red when it is superficial. Bright red lesions can be seen if it is superficial. It is most common type in infants. Lobular capillary hemangioma. It is also called as pyogenic granuloma. Reactive vascular lesion, common on gingiva, lips, tongue, and skin. It bleeds easily. Gross features. The gross features of capillary hemangioma are: it is soft, raised, red to bright red lesions are seen. It is well circumscribed but usually non-capsulated. Size vary from few millimeters to several centimeters. Surface may be smooth or slightly lobulated. Blanches on pressure due to blood within vascular channel. On cut section, it appears spongy and blood filled. Commonly found on the skin of the face, scalp, neck, and oral mucosa. This is the gross appearance of the capillary hemangioma. Microscopy of capillary hemangioma. Numerous capillary-sized blood vessels arranged in closely packed lobules. The vessels are lined by single layer of flattened endothelial cells. The lumina contains red blood cells. Scant connective tissue stroma between capillaries is seen. Lesion is usually well circumscribed and not capsulated. No cellular atypia or significant mitotic activity. This is the microscopy of capillary hemangioma. Now let's see the clinical features of capillary hemangioma. It usually appears within the first few weeks of life. Rapid growth during the first year of life is seen. It is followed by spontaneous regression. Commonly occurs on the skin of the face, scalp, neck, and trunk. It also appears on lips and oral cavity. It also appears on eyelids and orbit. It presents as a bright red raised lesion if it is superficial, bluish swelling if it is deeper. The complications of capillary hemangioma: ulceration, bleeding, cosmetic deformity, visual or airway obstruction when located near the eye or respiratory tract. Diagnosis: usually clinical. Imaging such as ultrasound or MRI may be used for deep lesions. Biopsy is rarely needed unless the diagnosis is uncertain. Treatment: observation for uncomplicated lesions may regress spontaneously. Medical therapy: propranolol. It is the first line for problematic infantile hemangioma. Topical beta blockers for small superficial lesions are also used. Laser therapy is also preferred. Surgical excision in selective cases are also done. Cavernous hemangioma. Definition of cavernous hemangioma: a benign vascular tumor composed of large, dilated blood-filled vascular spaces. These are called caverns, and these are lined by endothelial cells. Gross appearance of cavernous hemangioma. The cavernous hemangioma is soft, spongy, and it is compressible mass. It is bluish red to red in color, usually larger and deeper than capillary hemangioma. The cavernous hemangioma is poorly circumscribed and it is also often non-encapsulated. Cut surfaces show large, dilated blood-filled cavernous spaces. May contain areas of thrombosis, fibrosis, or calcification. Phleboliths in long-standing lesions. This is the gross appearance of cavernous hemangioma. Microscopy of cavernous hemangioma. It contains numerous large, dilated, blood-filled vascular spaces called as caverns seen under the microscope. Vascular spaces are lined by a single layer of flattened endothelial cells. The caverns contain abundant red blood cells. The fibrous connective tissue septae separate the vascular spaces. Lesion is often poorly circumscribed and may infiltrate the surrounding tissue. No significant cellular atypia or abnormal mitotic activity is seen. This is the microscopy of the cavernous hemangioma. We can see large spaces filled with blood. Cavernous hemangiomas are commonly classified based on their location. Cutaneous cavernous hemangioma occurs in skin and subcutaneous tissue. Hepatic cavernous hemangioma, the most common benign vascular tumor of the liver. Intracranial cavernous hemangioma, cavernoma, cerebral cavernous malformation, found in brain or spinal cord. Orbital cavernous hemangioma occurs within the orbit of the eye. Cavernous hemangioma of mucous membranes seen in sites such as oral cavity and gastrointestinal tract. Clinical features of cavernous hemangioma: usually presents at birth or appear in early childhood. Appears as soft, spongy, bluish red swelling. Lesion is often larger and deeper than capillary hemangioma. It is compressible and may increase in size on crying, coughing, or straining. It is usually painless. May occur in the skin, subcutaneous tissue, liver, brain, oral cavity, and other organ. It can also cause cosmic deformity when it is large. Bleeding or ulceration may occur after trauma. Large lesions may compress the nearby structures and produce symptoms depending on the site. Unlike capillary hemangiomas, cavernous hemangiomas do not usually regress spontaneously. Diagnosis: clinical examination. Soft, compressible bluish swelling is seen. Imaging: Doppler ultrasonography or MRI to assess its extent. Confirmation: histopathology showing large dilated blood-filled vascular spaces lined by flattened endothelial cells. Treatment of cavernous hemangioma: observation for small asymptomatic lesions, surgical excision for symptomatic enlarging or cosmetically disfiguring lesions, sclerotherapy for selected lesions, laser therapy may be used in superficial lesions, site-specific management for lesions in vital organs, example brain, liver. To summarize what we have seen about hemangioma, in simple words, hemangioma is a benign non-cancerous mass formed by abnormal collection of blood vessels. Capillary hemangioma, in simple words, capillary hemangioma is a benign non-cancerous growth made up of many tiny blood vessels, capillaries. The key features of capillary hemangioma: it is benign non-cancerous tumor of blood vessels. It is made up of small capillary-sized blood vessels. It appears as bright red or reddish purple lesion. It is usually soft and slightly raised. Commonly occurs on skin, lips, tongue, face, and oral mucosa. Frequently seen in infants and children. May grow rapidly in early life and then slowly regress. It is usually painless. Bleeds easily if injured. Cavernous hemangioma. Cavernous hemangioma is also a benign non-cancerous growth made up of large dilated blood vessels filled with blood. The key features of cavernous hemangioma is benign tumor of blood vessels made up of large dilated vascular spaces, larger than those of capillary hemangioma. Usually blue or bluish purple in color, it is soft and compressible on pressure, may occur in skin, liver, brain, lips, tongue, and other tissues, usually present from birth or develops early in life, can bleed if injured, less likely to disappear on its own than capillary hemangioma. Now let's see the difference between capillary hemangioma and cavernous hemangioma. Definition: capillary hemangioma is a benign tumor made up of small, capillary-sized blood vessels. Cavernous hemangioma: it is a benign vascular lesion made up of large dilated vascular spaces. Size of vessels: in capillary hemangioma, the vessels are small, tightly packed capillaries. In cavernous hemangioma, the vessels are large, blood-filled cavernous spaces. Common age: capillary hemangioma occurs mostly in infants and children, whereas cavernous hemangioma occurs more common in adults. Typical location: capillary hemangioma occurs on skin, lips, face, and oral cavity, whereas cavernous hemangioma occurs on liver, brain, and deeper tissues. Appearance: the capillary hemangioma appears red, superficial. It is also called as strawberry hemangioma. The cavernous hemangioma is bright red and it has deeper swelling. Consistency: the capillary hemangioma is soft and compressible, whereas the cavernous hemangioma is soft, spongy, and more compressible. Growth pattern: the capillary hemangioma shows rapid growth in infancy, then involution. The cavernous hemangioma is usually slow growing and persistent. Histology. Numerous small capillaries lined by endothelial cells are seen in capillary hemangioma. Large dilated vascular channels separated by connective tissue is seen in cavernous hemangioma. Complications. Ulceration and bleeding is seen in capillary hemangioma, whereas thrombosis, hemorrhage, compression of nearby structures is seen in cavernous hemangioma. Prognosis. Capillary hemangioma often regress spontaneously, whereas cavernous hemangioma usually do not regress spontaneously. The treatment: observation, beta blockers, laser if needed in case of capillary hemangioma, surgery, embolization, radiosurgery depending on the site in case of cavernous hemangioma. Thank you.